Spinal stenosis is a condition of a narrowing of the spinal canal. The spine has a bony tube. Inside of that is the spinal cord and the nerves. Over time, the size of the canal narrows. Some people can be born with a smaller canal than other people, but other conditions can cause this type of spinal stenosis. There can be bone spurs, could be herniated discs, there could be slippage between the bones, all leading to a narrowing of the spinal canal, pressure on the nerves, and then symptoms.
Well, before I had this condition and before it presented itself, I was very active, work out in the gym 3 days a week with some private trainers. I'm very health conscious. I like to maintain my cardio health, my strength. I have a 3.5-year-old granddaughter that I need to chase around, and she needs to chase me around, and so I can't be limiting those activities.
Typically, the symptoms of spinal stenosis are back pain and leg pain, particularly pain with walking.
It had gotten to the point where, even at the latest point, I was walking with a cane. And to the point where when I finally got to the surgery, literally to the hospital on the day of surgery, I needed help to just get undressed for the surgery. I couldn't bend over and even untie my shoes or take my socks off.
When patients with spinal stenosis are evaluated at the Spine Center at New-York-Presbyterian Hospital, we really have a conservative approach at first. The patients will usually see a physiatrist, which is a rehab doctor, often a pain management doctor, physical therapy, neurologists, possibly a neurosurgeon as well. And we will usually want to start with the non-operative treatments, such as physical therapy, anti-inflammatory medications, epidural steroids, before going ahead to surgery. It's really a major advantage to patients to be treated in a spine center such as the one here at New York-Presbyterian, because they can gain the benefits of all of the disciplines working together for the best treatment and patient outcome. This is an MRI scan of Mr. Weinreb, looking at him from the side, where this is his back, this is toward the front, this is the spinal canal. This area is normal, where the white is the spinal fluid, little lines of the nerves, and this is nice and open. At this spot right here, this is L3-4, there's a very significant narrowing of the spinal canal, which is the spinal stenosis. Certainly the most common operation for spinal stenosis is a laminectomy. A laminectomy is a removal of a window of bone in the back, helping to reduce the pressure on the nerves. Sometimes I make the analogy of like taking the roof off of a house to increase the size of the spinal canal. That is an operation, usually takes about 1 to 1.5 hours. Typically patients are up and walking the same day, home within a day or two.
And I surely thought that he was just going to confirm what the spinal surgeon said, that this is the standard procedure. And I was really quite surprised when he said to me, well, I have another approach that we've been very successful with.
The XLIF surgery stands for extreme lateral interbody fusion, and that is a type of a fusion that is performed from the side. Really, probably the least invasive way to get to the spine is from the side, not necessarily from the back. One of the advantages coming in from the side is we avoid a lot of the muscles in the back that have the support of the spine, and we're not causing any trauma to those. For the XLIF surgery, the patient is positioned on their side. Electrodes are connected to the patient's legs so we can monitor the function of the nerves to allow a safe trajectory down to the spine. A series of small tubes are then passed. Each one of these is connected to the neuromonitoring to allow a safe trajectory down to the disc space. Over the tubes, a series of dilators are then placed to open up the muscle without actually cutting the muscle. Once the dilators are placed safely, a tube is then passed down to the disc. Through the tube, various instruments can then be passed. The disc space is then cut. Various bone instruments can be used to remove any bone spurs. The disc space itself is then removed. Once the disc is removed, the spacer is then placed. The spacer itself is packed with a bone matrix, which is what encourages a person's own bone to grow together and knit to create the fusion.
For someone who has never had surgery ever in their lives, and you wonder what is it all about, this was the most remarkable experience that I've ever had, and nothing that I ever expected. And everything about it was about me, not about who they were or that they were there to perform a certain procedure or to prepare me. It was about my comfort, how did I feel, their concern for me, all the way through, every step, you know, short of calling it the miracle surgery, at least for me, that's what it was. It exceeded any expectation that I had. I went in looking for relief, thinking that over time this would create some benefit. I didn't expect an immediate benefit, and it literally was an immediate benefit. I came out of surgery, and in recovery, all the pain was gone.
This was Mr. Weinreb's x-ray soon after the surgery. This is looking at him from the side, where this is his back. This is heading toward the front. This is the spacer that was placed within the L3-4 disc. These are the titanium screws, and this is the rod in between. To me, one of the major advantages of the minimally invasive surgery is that they're much less traumatic to the body. Typically, after an XLIF surgery, I will have patients up and walking the same day.
The night of the surgery, they came into my room and said, okay, we're going for a walk. And I just stood up out of bed. And of course, pain from the surgery, you're always going to have that. But I stood up and I walked. And then the next morning they said, go take a walk. And I walked myself. The post-surgical recovery was faster than I expected. There was no physical therapy involved. I went home with instructions: don't lift anything greater than 10 pounds. Don't bend from the waist. Don't drive for a couple of weeks. Give your body a chance to heal.
In patients who I feel are excellent candidates for spinal surgery, I really look at how they want to recover and get back to their previous activities and lifestyle. I know that patients who are motivated are going to be the best surgical candidates. In Mr. Weinreb's case, he was very motivated to get back to his prior lifestyle and prior activities.
Clearly, this has changed my life. It gave me back what I wanted back, which was that youth, you know, and I think in those terms. And to me, the ability to do what I want, when I want, and to enjoy my granddaughter growing up, that's the key to everything.